The success of any great project actually starts with a vision. And in this instance, what we're talking about is health. The well-being of a population. Here, we're talking about our nation. This is a key pillar or component in any development process. There's no economic powerhouse, there's no economic activity, growth in economic activity without a healthy population. With respect to the vision, I am proud that 40 years ago, the government of Antigua and Barbuda had the foresight to establish the medical benefit scheme, a system of socialized health care to cater for the masses and allow them to access health care without facing financial hardship. And you can well imagine that in 1978, we weren't even independent as yet. It means that we had a significant amount of people who fall within this working class mass that could not afford health care. And having a collective responsibility in how we do that, how we cater for people's lives, was actually important. The MBS have actually served us well. They've served us well thus far, but as time changes, we must also evolve and meet what are now new and daunting challenges associated with changes in disease burdens and access to modern healthcare services. The discussion this morning and from the questions that I've seen here, it begs the question as to what would this transformation look like? What will MBS look like next week? What it will look like next year? And this is why we're here. This is why we're here, this is why you are here, and this is why we're engaging. We have heard a number of buzzwords this morning. Universal health care, national health insurance, health system, costing and financing structure, legal framework, service delivery, service standards, health information system, and what is critical as well, safeguarding individual health and the process associated or dealing with that specific thing. Our goal is to engage with you, the stakeholders, and the population in an open and transparent manner, and to come up with a structure, a framework for delivering affordable health care in a cost-effective manner for all citizens of Antigua and Barbuda, but it will be unique to us. We have had 40 years of experience in doing something. And the original design of the MBS in 1978 is not where we are now. We have evolved, we have morphed into doing other things. We are now financing other type of arrangement. We are now outsourcing different type of care, orthopedic care, different structure that we're actually looking at. Minister mentioned, I think the CMO mentioned that we're looking at now engaging with cardiac care. These are things that we've been doing, not in our original mandate, but you know, usually when you have a job description, it says that it depart, any other services or any other duties, and the minister has been using that to full effect. But I must say, I cannot disagree with his position. I heard him making a couple of points in Parliament one time about trying not to shirk the responsibility of providing service or access to anyone. And suffice it to say, notwithstanding the mandate or the extended mandate of MBS, what we have seen is going towards making the health system better. And that I can certainly appreciate. So we are not really sure what the final product of this MBS will look like. We are at the beginning of the work, the beginning of the consultancy, and that's why our able consultants from the University of West Indies are here. But again, I want to reiterate the point made by the Minister and the CMO that we will be collaborating in a transparent and open process, and we will engage the stakeholders and the wider population in every step of the way. As the Minister mentioned, we are putting the necessary structures in place to support the work of the consultants. Similarly, we are setting up parallel committees at the Ministry of Health. MBS will do so as well at Mount St. John's Medical Center to monitor the work and the output of the consultants and to look at what is required for us to change to accommodate this transformation into universal health care that we are actually talking about.